Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. I would like to do a short video explaining about attrition bargaining and the 1%. And this has to do specifically with the transit workers contract. So I was asked again to answer about a question that came up during Shopgate, where Mr. Davis went to the Jackie Gleason garage and was talking about the contract that he was trying to get ratified last year. I want you to watch this video and then I'll explain exactly what he's saying.
Get into it, but the package itself has an overall value with the wages and the benefits that we talk about. I call those the sprinkles or the extras. The total value of the contract is over $870 million, nearly $1 billion. A 1% raise in our contract, 1%, is close to $38 million, almost $39 million. So this is not small ball, this is all big stuff. And we need to understand how this gets around because a lot of people are under different misconceptions.
So 1% in your contract has a value of $38 million. That means for every 1% raise that you are trying to negotiate, the MTA is going to look for a 1% in give back. What are you going to give them back? You heard Mr. Davis talk before about the Medicare Advantage plan, that they increased the rate up to 2%. Where did they get that 2%? He talked about that the cost of the Medicare Cppo plan, the supplement that they gave back to the MTA, that is a give back. He can't say it's a clean contract, and that was also said in the full length of this video. This was not a clean contract. This was a give back. And so what happened is you'd have to price out what it would cost the give back for the Medicare supplement Cppo plan. Well, we did that, and that was actually part of an affidavit that I provided in a litigation to support your retirees. So if you were to just go back on older numbers that we were given, about $250,000 per member per month for the Medicare supplement, times the number of your retirees, times 12 months, you get $72 million a year. That was also the same number, close to that same number as what we were given. Actually, we were given $72 million from the union's attorney. I think my numbers came out slightly lower because I was using numbers, the total number of retirees that I was given. So I would defer to what a union attorney had said because his numbers would be more accurate than what we were given as hypotheticals. But take the figure of $72 million, that's 2% right there. So by giving the supplement back to the MTA, you gave management $72 million back. And what did he give? The union was $72 million, 2% additional in a raise. Now, you know that did happen, in fact, because the union attorney actually, on the interview that he had with me over the summer, actually said that. Oh, well, the MTA said, if you put your retirees into that Medicare Advantage plan, we'll give you a raise. And they did. So he's also, Mr. Davis is even talking about the 2% increase. And you also do know that this subsidized plan is privatization of a public health benefit, Medicare, that the MTA no longer has to pay for the premium for the Cppo, which was about $250 a month per person. So it's not really a clean contract. Now, if he wants to say that it's clean and that he didn't take anything away from employees, he only took it away from retirees who are no longer in the union, I would still have a problem with that because he is then not identifying that his current workers will one day be retirees. See, our generation always looked to protect our futures. We knew that as young people, that when we were young, we were able to work harder, work longer, work more overtime, maybe hold 2 jobs. You know, we can do a lot more than we could, but we wanted to make sure that the fruits of what we labored for, we would have when we needed it most. This younger generation must start to look to their future, because if they don't, then they're going to be in a worse situation than they are now. Sometimes a raise isn't just cash. It also has to be the value of a benefit, which he does even say in part of his speech, that it's not just the percentage raise increase, that the benefits do have a value, and they do. So you also do have to understand that is a benefit. When the part of the speech that I did cut out was about LaTanya talking about her cancer, she does talk about the cost of the healthcare coverage plan. Now, typically it's about $10,000 or $9,000 a year for a single person. I think about $25,000, $30,000 a year per family. That is what the MTA is paying for all of you. So understand that this is attrition bargaining. They gave something up to get something for their peoples today. This is a give back. And we have to keep saying that this isn't a them versus us. This isn't retirees versus employees. Employees have to identify, we're not complaining about having a benefit stolen. We are complaining that we earned this. This was our benefit. We relied on this, and that we are being forced into a diminished healthcare plan so that they could get a raise today, because they're not understanding that they just sold off their futures by ratifying that contract. Remember, the union president said, this doesn't affect anyone in this room. This is only for those over 65, like they were nobodies, or you're not them, they're not us, don't worry about that. But they are. You, as the active worker, this is your future. You need to understand this, because that's just what happened. You were forced into a privatized healthcare plan. One of the talking points the New York City retirees use is that our current unions, we have a choice of plans. We have 14 choices of plans, because under city statute, the city is required to provide health coverage for us up to a certain point. One of the plans that is the most favored plan by both active and retirees is the Emblem Health GHI Comprehensive Benefit Plan, or GHI CBP for short. You used to have that plan. That was a union nonprofit organization. That healthcare plan is nonprofit, and they were OPEIU 153. Now, to have kicked them to the curb for a for-profit managed healthcare plan that is non-union, to me, is criminal. I don't understand why labor would support not a for-profit non-union plan. Emblem provided an adequate plan for those regionally in the New York vicinity. Where the complaint was, even in New York City retirees, is that if you were from the point of retirement under 65 years old, your healthcare plan under Emblem did not go wherever you needed to go. If you moved to Florida, Iowa, Illinois, it didn't follow you. You had a problem. So they needed a national plan, which is what they ended up negotiating there currently for the active workers for New York City right now. Is Emblem provides the regional coverage, and United Healthcare will cover the national plan, national coverage. So I can't tell you what that will look like, because it's still in the negotiation process, but unions should be looking to nonprofit union plans if possible. Aetna is neither one of those, and it is a diminishment of your benefit. And I know the TWU 100R retirees are looking forward to their day in court to be able to prove that, because the New York City retirees were able to prove that in our litigation. And I'm hoping that even on appeal, we become victorious, and the retirees for transit have their victories as well. So stay tuned. Understand that this is another example of attrition bargaining. They're not going to tell you that, but it absolutely is. We need to find out exactly how that money was spent. And he does actually say that in one of the other videos, where he says that they increased the Medicare B reimbursement on one of your options, but not the other. And that one option was made for those that are more healthier, and one was made for those that are more infirm. So if you're using medical more often, you're not going to get the reimbursement, but you're not going to have copays, right? I understand that, but that's not the full $72 million. And that's a problem, because then part of that went to that, and part of that went to raises. So there's your 1%. It's $38 million is 1% value in your transit worker local 100 contract. And the cost of the Cppo supplement plan was $72 million a year. That's equivalent to 2%. Remember, fight for the union that you want. You are the union.